Hi everyone, this is Kim Aaliyah, and welcome to the second session in More Patients, Better Results, Improving Your Success Using Homeopathy for First Aid and Acute Care. Tonight's session is entitled How to Evaluate Acute Situations to Ensure Patient Safety with Dr. Marianne Ivans. In 2 weeks, we'll have another session, session 3, entitled Using Homeopathy for Acute Conditions at Home with Dr. Joe Kellerstein, Dr. Marianne Ivans, and myself, Kim Aaliyah. And then on June 28th, we'll have a session entitled Homeopathy for Ear Infections with Kim Aaliyah, myself. And then on July 12th, the final session in the series entitled Homeopathy for Injuries at Home with Dr. Joe Kellerstein and Dr. Marianne Ivans. So these sessions are all sponsored by Homeopathic HouseCall. If you want more information about that, you can go to homeoaide.com and you will see information about Homeopathic HouseCall. So let me just give Dr. Ivans a quick introduction. Dr. Ivans has been in practice for 27, 28 years now, I believe. Incredible clinical practitioner. She was involved directly with the development of Homeopathic HouseCall. She has a wealth of knowledge relative to homeopathic practice. She's a nurse, an accomplished homeopathic practitioner. She was involved with the American College of Homeopathic Medicine out in Arizona, and she is a tremendous wealth of information on many different levels. So we're very fortunate to have her presenting this evening. I'm going to go ahead and pass it over to Dr. Ivans.
Hi, everybody. What I'm going to do tonight is talk about how to assess acute conditions at home. With our Homeopathic HouseCall, we have a number of conditions that have certain caveats with them.
Marianne, can you click on Show My Screen so people can see your screen?
Oh, I'm sorry. Yes. Can you see my screen?
Very good. Thank you.
Okay. So this particular program has a lot of conditions, some of which contain caveats. And the caveats have to do with when to seek medical attention. And what I would like to do tonight is talk to people about how to assess these things in the home without a medical supervision, and help you know when to seek attention. So let's start. So allergic reaction. And actually, I'm going to go through each condition, and then I'm going to ask if there are questions, and I want people to participate, please, because I want to answer questions, because this is very important. So with an allergic reaction, difficulty breathing and shortness of breath, and use of accessory muscles, and hyperventilation are all conditions where you should start to think about getting some help. Swelling around the neck and face, and any previous anaphylactic reaction.
That is to say, Dr. Ivans?
Yes.
That is to say, if the person has a history of a previous anaphylactic reaction.
That is correct.
Okay.
If the person has any kind of condition where they've had respiratory distress before, you want to take that into consideration, and you don't want to wait. Even if you've given a homeopathic remedy already and you're not sure what the reaction to that remedy is, you don't want to just say, oh, well, this is a return of old symptoms, oh, this is an aggravation. In an acute condition, if you have a worsening of physical symptoms that are directly related to the condition, you don't want to mess with it.
So one more question.
Yeah.
How would folks know if the patient is using their accessory muscles of respiration?
Well, actually, we're going to have a picture of that in another couple of conditions.
Great.
But the chest, and this usually is not with older people, because with people who are above 7 or 8 years old, you can really tell if they're in respiratory distress. We're going to see a picture later with Croup, actually, where it's a child under a year of age who is breathing, who is having respiratory distress, who has a concave chest. And that's how you can tell they're using accessory muscles. So in an older person with an allergic reaction, this is a lot more obvious than it is in a young person. Does that answer the question?
Yeah.
Okay, anticipatory anxiety. So you want to be alert for symptoms of panic attack. And once again, a lot of times these are respiratory symptoms. Hyperventilation, fear or anxiety where the person just doesn't really understand where they are or what they're doing, and lots of restlessness. You have to learn, the differentiation for this is a coronary event, and many times people go to the ER with a panic attack or an anxiety attack, and they get worked up for a myocardial infarction. So you really want to understand that what you're seeing is more of a respiratory event than a coronary event, because anticipatory anxiety leads to a faster respiratory rate, which can lead to depleted CO2, which leads to dizziness, which leads to tingling in the extremities, all that kind of thing that is a very physiological response to a respiratory event. Any questions about this?
Yeah, Marianne?
Mm-hmm.
So a question here. How would people know the difference between hyperventilation in anxiety and respiratory distress in an anaphylactic response?
Okay. First of all, you have to look at etiology. So if the person has come in contact with a substance that they've had a problem with in the past, or they've come in contact with a substance and these symptoms are directly related to it, then you're looking probably more at an anaphylactic kind of thing. And actually, anaphylaxis happens after the first time exposure. So the first time exposure does not lead to anaphylaxis. It's the second time exposure. With anticipatory anxiety, there is an emotional plane situation that is leading the person to be in this state. So it's either having to deal with your parents after you have to tell them you've dropped out of college, or, well, you know, it's that kind of, it's an emotional situation that is going to lead you to be in an unstable state. It can be having to give a talk. It can be, you know, you're going on stage. It's whatever. It's anticipatory anxiety. And so the symptoms the panic attack can happen for all kinds of reasons. And sometimes panic attacks have no reason. A person that's had some kind of emotional trauma, let's say they were carjacked. That's a big old emotional trauma. And whatever triggers the memory of that can lead to these same kind of panic attacks. It doesn't have to necessarily be anticipatory anxiety. It can be anxiety of any kind that leads you to a place where you remember a situation that caused you problems. And so the result of that is an increase in adrenaline in your system. And adrenaline leads to increased heart rate, increased respiratory rate, increased salivation, all the kind of stuff that you see with hyperadrenal stuff. This is all about hyperadrenal reaction to a situation. So hyperventilation, which leads to blowing off your CO2, and that leads to paresthesias in the periphery, faintness, all that kind of stuff. Restlessness, certainly, because you're hypoxic as well when you do that. And so you have to learn, you know, with this whole thing, sometimes coronary events can look like this, and so that's your differential diagnosis. Does that make it any clearer for anyone?
We don't have any questions here, so I think we're doing okay.
Joe, how about you?
Well, I was kind of wondering if there were any little tips. If I had this image of I happened upon somebody, and that somebody looks like they're panicking, and I can't get history, and they're having respiratory distress. Do I assume it's anxiety?
No, you do not.
What would I do?
You do
what would
not. I would take their respiratory rate and I'd ask them if they have chest pain.
And then do what as a follow-up?
Call 911.
Thank you. That's what I wanted to know.
Whenever in doubt, you call 911. And sometimes these anxiety attacks are enough to initiate 911 response. Because they can be pretty awful.
Thank you, Marianne. Excellent.
And a nice dose of arsenicum or aconite can take the edge off, but they always should be assessed.
Good.
And here we are at chest pain. So you don't want to ignore or miss what might be a coronary event, and we've just been talking about something where the differential diagnosis is in fact a coronary event. The presentation of chest pain and coronary events in males and females are very different. And all the research up until, gosh, maybe 10 years ago was all done on males. And males present really differently than females. And female coronary events are usually in smaller vessels than in males. So it's not just the big three, you know, the left anterior descending and the circumflex and the right coronary artery. That's normally where males have their coronary events, but females have their coronary events further down the line. So they present differently, and they generally present with gastrointestinal symptoms. And they don't necessarily say crushing chest pain, for instance. I had a lovely woman in my practice that came into my office, and she had been working on her, she was 65, which is a few years younger than I am right now. She had been re-roofing her house, and she had indigestion for 3 days. And she came into my office on day 4, and my secretary, who was a genius, just asked her to please just sit down. And I came in and took one look at her and said, oh my God, this lady's having a coronary. She'd had indigestion. She went to the emergency room the night before. They'd sent her home with Pepto-Bismol. I did her EKG, and she had what I saw as anoxia. She had depressed ST segments all of her left-sided leads, and we took her to the hospital, and she had a 3 artery bypass. Now, she had no crushing chest pain, none of that kind of stuff. So you have to be really careful when looking at people who you think might have coronary events, because they definitely present, males and females definitely present differently. And the differential diagnosis of chest pain is costochondritis. And costochondritis is an inflammation of the muscles between the ribs. And lots of people go to the hospital because they've got costochondritis and they get worked up for chest pain, and it ends up being totally musculoskeletal. And the way you differentiate that is by taking a good history. And if a person has been using a computer, for instance, for the first time, you've got to figure out what their ergonomic situation is in their house. Are they raising their arms and using their computer without resting their elbows on anything? It causes pain in the intercostal spaces in their chest. So a good history is a wonderful thing, and the remedies that you're going to use, and you'll see that in the program, for coronary problems and for costochondritis are going to be different. And the questions that you're going to be asked in the program are different. Any questions about this?
Someone did point out that cold sweat might also indicate a coronary,
Yes.
as a nice differential.
Yes, if a person is diaphoretic, if they're sweating, then the chances of it being a coronary event are, in both males and females, is greater than something like costochondritis, where they're really not sweating unless they live here in Arizona.
There's another question about salivation. You'd mentioned salivation as a symptom of increased adrenal activity. And so someone was wondering if this might be another nice differential symptom. Would you see salivation in a coronary event?
Not necessarily.
All right. And the last question on this topic, do males also present with indigestion sometimes when they're having an MI?
Actually, they present with nausea more often.
All right. That's it.
Okay. Circulatory shock, something probably nobody is ever going to see. This is caused by a sudden loss of blood volume, and I won't say in the old days, some years ago, we had a lot of, well, I don't know if a lot, we had cases of circulatory shock from women using tampons when they left these guys in for a long time and got a vaginal infection that led to septic shock. It was called septic shock syndrome. What happens is that the systemic infection causes a sudden decrease in blood volume due to fluid, or I don't want to say fluid, the blood vessels. And actually death. Usually, circulatory shock happens because of massive blood loss through trauma. Septic shock is less common. Have a a sudden failure. This is not something that you're going to see very often. And if you suspect it at all, this is the time to call 911. There are remedies that you can give, camphor being one of them, that will help at least sustain the person, but you really cannot wait to see if you get an aggravation or anything like that. This is one of those things where you call 911, you give the remedy, and you hope for the best. Any question about this? And you'll recognize this because the person will probably be non-compos mentis sooner than not.
Translate that for us, if you would.
Oh, they can't think.
And what is, there are other first aid measures that are usually taken for circulatory shock, I believe.
You know, short of mask pants and fluid replacement, I don't know.
Well, raising the legs, I think, right?
Well, that's what mask pants are all about. I mean, you can do that, but this is serious business. Raising legs is not going to help this. I mean, it's not going to hurt it, you know, but, and you can do it. I mean, it's better than not doing anything. But this is a very serious business.
Did you mention a remedy, Dr. Ivans?
Camphora.
Camphora, yeah, several people asked. All right, we're good.
Our friend the croup. Now, croup is a really common business, and in general, croup is not a problem. The potential problem here is epiglottitis. If you get an inflammation of the epiglottis, you can have respiratory distress because it can impede airways. So once again, and this is, I think, where I was talking about before, this is where you see sternal retraction with respiration. And I think, there we go. You see the lovely V in this child's chest? That's sternal retraction, where you take a breath in, and instead of expanding the lungs, because of obstruction, you get the chest going inward instead of outward. And that's the biggest problem with this. And anytime you have a respiratory problem in kids, and you're worried about progression of pathology, one of the things you want to do is really look at these kids' breathing. And as long as the chest is expanding, you're probably perfectly okay. But the minute you see this, you are not perfectly okay. Questions?
None at this point.
Okay. Any questions about croup? Because croup in general is not a biggie. All right. Diarrhea is another one of those things, very common. But the problem is, if you have it for too long, dehydration can be a problem. And dehydration can be a problem in a number of things that we'll talk about, so you're going to hear this over and over again. Loose stool and diarrhea, actually gets misdiagnosed, or the definition is loose stool, more than 3 to 5 stools a day, for more than 3 days. And what happens is your intestinal tract is not reabsorbing fluids as it should, so that your stool is not as concentrated and as formed as it should be. And it can be a problem because what you're doing is losing fluid. And when you're losing fluid, you get dehydrated. And dehydration is the enemy. And if it goes on for a very long time, if it goes on for more than 3 or 4 days, depending on who you are, you might not be able to rehydrate by oral means. You may have to have an IV to rehydrate you. And if you are a young person, that is to say, somebody, let's say, under 8 years old and under 70 pounds, they tend to lose a lot of fluid quickly, more quickly than adults. Or if you have an older person, they tend to lose more fluids than younger people. So dehydration is the enemy in this case. And when you start to see dehydration, you have a change in mentation, that is to say, how people interact with their world. And you tend to have a feeling that you can't cope, and loss of consciousness, all that kind of thing. So if you've got a person that has a loss of fluids with diarrhea, then you need to be really conscious of their mentation. And they may need to be fluid replaced. And with diarrhea, its etiology is really important. We haven't had it in a while, but we've had E. coli scares over the last, I guess, the last one I've heard about was probably about 3 or 4 years ago. But still it's there. And if you have bloody stool, if you have mucus in your stool, if it's acute, you have got to be very serious about treating it. You can't just wait around. You can't just give a remedy and wait until it works. It has to work, and it has to work immediately. Questions?
Yeah, Marianne.
Yes?
Other than mentation or ideation, are there physical signs, for example, the skin or the mouth, that might indicate dehydration?
Well, skin turgor certainly, and that means that you take a pinch of the forearm skin and you let it drop, and it should drop back. It shouldn't just sort of sit there tepid. But if a person gets to the point where their skin turgor is not good, they're way past the point where they should have been seen.
So that would mean that if you pinch their skin, it just sort of hung there and stayed there?
Yep, it stayed tented.
Now, what about their mouth? Would they necessarily be thirsty or have a dry mouth if they were dehydrated?
Depends on their remedy. You would think that if they were dehydrated, they would want to drink. But if they're pulsatillas, are they going to?
But would their mouth be dry?
They might be dry.
Okay, so their mouth might be dry, but they may or may not want to drink.
Correct. And by the time their mouth is dry, it's already been too long.
So what's the indicator in diarrhea that it might be a 911 situation?
Bloody stool.
Or more than 3 days?
Definitely more than 3 days. Well, I don't know if it'd be 911 for 3 days, but they definitely need medical attention. Diarrhea generally does not go to a 911 situation, but it's definitely something where you need to seek medical attention.
Marianne, what if you had a child with diarrhea for 3 days and obvious weight loss?
Oh, get him to the doc. You know,
Well,
if you think if you're coming up on the machine with veratrum album, that child needs to go to the doctor. Because at some point, you can't rehydrate a person orally. It has to be IV.
interesting.
Because they're way past what's going to help them orally.
Good to know.
So you may help them with a prescription of veratrum, but you may also help them more by getting them to urgent care and getting them some fluids.
Yes. What we'd like is for these kids to get the remedy before they need to be rehydrated parenterally.
Yeah, you know, I think that's a very important point, Hart, that in epidemics of cholera, the number one factor tending towards mortality was the severe dehydration. Right, Marianne?
Very much so. Yeah.
So Marianne, we had a couple of questions come in about croup. You know, there's always a kind of a lag time on the when the questions come in. And basically, people were just wondering what remedies you recommend, and we could just run through the triad that we use on Homeopathic HouseCall.
Well, yeah, that's for sure. And of course, we know that there are no remedies for anything in homeopathy. My students have this tattooed across their chest. There are no remedies for anything. But there are classic presentations. And the classic presentations of croup seem to be spongia, which may be number one, Hepar sulphuris, and aconitum, if these are things that happen at 1 or 2 in the morning. What else, Joe?
Well, that's our triad.
Okay.
On Homeopathic HouseCall, I think we felt that that covers a large proportion of cases.
Giant proportion of cases.
Yeah.
Well, I didn't hear all of it. I don't know if we mentioned aconite.
Yeah.
Yeah. Aconite, Hepsulf, and Spongia tosta.
Okay. That mostly does it.
Okay. Any other questions about croup?
For a true croup, we have a number of people suggesting Drosera, and then someone says Drosera for pertussis, which of course this isn't pertussis we're discussing right now.
Right. Well, and always you take the case. You know, because croup is not always, you know, spongia, aconite, and hepar don't always cover croup. You know, if you have a croup that's after midnight where the person has to sit up and they're cough, 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 and then vomiting, you got to think about Drosera. Just depends on how it presents.
All right. We're clear on questions.
Okay. So drowning. I want to say if a person's been pulled out of the pool or wherever, they need to be medically assessed. But definitely, if there's any kind of loss of consciousness, they need to be medically evaluated. You can't just pull them out of the pool and say, okay, we're all good. If they've aspirated water, you've got to be aware of signs of infection because that kind of stuff is not supposed to be in your lung, and it causes all kinds of problems. And the severity of the sequelae depend on what was in that fluid. So hopefully there are no lipids, no fats, because lipid pneumonia is horrible. And chlorine is nasty, nasty, nasty if it's a pool. So for at least, even if the person hasn't lost consciousness and everything seems to be okay, if they have aspirated fluids, you need to watch them for the next 72 hours. That's just sort of it. Any questions about this?
I imagine we may have some in a few minutes.
Okay. Well, then I'll move on. Ear infection, something all of us see all the time, and mostly ear infection is a misnomer. That is to say, what gets labeled ear infection is usually ear inflammation. And it has to do with kids that are teething. It has to do with kids that have a casein intolerance, where there is inflammation in the mucous membranes, particularly when they're teething, because teething is not a benign process. Teething has to do with something akin to a nail coming through your arm. The Red Sea doesn't part and the tooth comes through. The tooth pushes through a membrane, and that kind of problem causes inflammation in the tissue around it. And mucous membrane tissue tends to inflame through the entire area. So that means the gums, the mucous membranes, the eustachian tubes, all that stuff. So most things that people call ear infections are actually ear inflammations. And unless there's a purulent discharge, there usually is not an infection. So homeopathy works fabulously on teething-involved ear inflammations. Now, if there is an actual infection where bugs are involved, homeopathy still works beautifully. But you also have to be aware that there is a possibility of mastoiditis. Mastoid bone is behind the ear. Getting an infection in there is a really bad thing. So you have to just make sure that that is not a problem in the case that you're looking at.
And the signs that that would be a problem.
There's tenderness behind the ear. There's usually a high fever. But it's the tenderness, you can feel the mastoid bone behind the ear. And this is an indication that you need to seek medical attention.
And that bone actually becomes quite tender, right?
Oh, yes. Yes, oh, yes.
All right. No questions on that one.
Okay. Fainting. One of my personal favorites. I used to do this all the time at church. So when a person faints, you've always got to check for traumatic injuries, because if a person truly faints, they can't control how they fall, and so they may hit their head on whatever. They should always be checked, and you should try to figure out why the person is fainting. It could be low blood pressure, it could be cardiac arrhythmia, it could be a ton of things. In my case, it was I couldn't stand the smell of incense, and probably I wanted to be outside in the fresh air. But there are all kinds of reasons that this happens. Fainting is not normal. So it's an aphorism 3 thing. You have to figure out why it's going on, and it can be an emotional plain deal as well, a vasovagal reaction, but you need to know why it's happening, because you can't have people just fainting, because they can hurt themselves, and it ends up being a constitutional problem, not an acute problem. So figure out the why and wherefore of this before you just send them away. Questions?
Marianne,
Yes?
just you know, I'm imagining myself. Here we are in church, and here you are fainting away, and I suspected that you hit your head on the way down on the pew.
You know, I never did.
Good for you. Shows a degree of elegance and dance training. So,
Well, I think I just got a little dizzy, and so I sat down. I never really passed out, and so that's why you have to differentiate this kind of stuff.
well, if you suspect they may have banged their head on the edge of a pew before they hit rock bottom, what would you do? I mean, would you get in there and physically examine them, move their neck, check for respiratory rate? What are you doing here?
I would definitely do that. And I would also give them a hit of arnica.
What about the possibility of neck injury or fracture?
Well, if I had seen them go down, I would probably know a little bit about that. If I hadn't, I would be very careful. And I would always support the neck. If they went down and it looked like their neck is a problem, I would have stabilized their neck and called 911 and done nothing else.
Good.
Until we got a collar on them.
And what would be the first remedies you might consider giving?
Arnica.
Okay. Very good. Thank you, Marianne. That was excellent.
So we have a number of people asking what remedies we do recommend for fainting, and that is to say for fainting itself rather than for the injuries sustained while fainting. And the ones that we have listed in Homeopathic HouseCall are Carbovegetabilis, Quina officinalis, that's China or Cinchona officinalis, Ignatia amara, Moschus moschiferus, and Nux machata.
Yes. Well, I can tell you this. If you're in the lab and somebody's getting their blood drawn and they're passing out on you, it's Carboveg. I mean, that's what it is. If they're having a hissy fit and they're thinking about passing out, it's probably Nux machata.
Having a hissy fit, how?
Oh, they're upset about something. Somebody's upset about something, and they're upset and they're restless and they're complaining and they're all that kind of stuff. That's probably Nux machata.
And if they're fainting in church?
They're faking.
Isn't that famously Ignatia?
It can be Ignatia, yes.
I know there are a couple of others as well, but
yeah, it's probably Ignatia. It depends on why. I know for me it was the smell of all that. I probably was a Nux vomica fainting because it was the smell of all the incense that really drove me nuts.
Yeah, in my experience, Hart, I would tend to agree with everybody really, but if the immediate precursor was kind of an argument with somebody, an upsettedness, that's Ignatia.
Yeah, I would agree.
So we do have a couple of questions about the first aid indications here. So how would you differentiate, let's say, low blood sugar and a possible diabetic issue with fainting, with, let's say, syncope?
Yeah. The only way you can differentiate that is to do a spot blood sugar. You know, and not everybody has that capability. And if a person is fainting because of low blood sugar, that's a medical emergency. So you're calling 911.
And so are you maybe asking people around, people who know the person, or the person if they're still conscious, whether they have diabetes, I presume?
You can, certainly.
You could also be checking their wrists hard for any kind of bracelet, which might indicate that they have some kind of medical issue. You could smell their breath for sweetness or the acetone kind of smell.
Well, that's really big low blood sugar with the ketone smell. And also, you can just get them a glass of something, you know, orange juice or whatever.
But the key there is calling 911 right away.
Yeah, I think so. I mean, the thing is that I'm not assuming that everybody out there is medically trained. What I'm trying to do is say these are things you look for, and if you see this, then this is the kind of stuff you have to do.
So if you see fainting in someone you don't know, perhaps 911 is the smart call.
Yeah, it is. It is.
You know, whenever you don't know, you call 911.
Well, and the other thing about fainting is, you know, it can be a vasovagal reaction. You know, somebody just is upset about something. It can be low blood sugar. It can be a cardiac arrhythmia, for God's sakes. You know, how do you know that?
And do you recommend also getting, you know, I mean, lacking an EMT and pressure pants, you know, you recommend getting somebody's feet up?
Oh, yeah.
Okay.
Sure. As if you can direct blood back to somebody's head, it's all good.
And someone's wondering if fainting from the heat is a particular remedy.
Well, it could be glenoidum. But, you know, what you've got is vasodilation, right? And so when you've got vasodilation, you've got decreased blood pressure, and that can cause a fainting event.
Here's a good one. What is the recommended protocol giving an unknown person a homeopathic remedy?
Well, it depends on what's going on with them. If they've had a trauma, I would not be averse to giving them arnica because, you know, it's sort of the aspirin of homeopathy. You know, it's anti-inflammatory. It helps deal with trauma. It is a very good choice if nothing else is going on and a traumatic event has happened.
I think the question...
If it's fainting, I would not be giving arnica.
I think the question is from more of a legal standpoint.
Oh, okay.
No, get the person's consent.
Yeah, I don't know what the laws are in most states, and I probably, unless I was pretty darn sure, and I travel with homeopathic, unless I was pretty darn sure, I would probably not give anybody anything.
All right.
That's just me.
We did have a question from someone earlier wondering if there are there remedies, I guess, is there a short list of remedies that are well indicated in mastoiditis?
That's a good question. I would tend to think mercurius, Hepar sulphurus. What else, Joe?
Well, in the historical case, capsicum is always huge.
Capsicum, yes. Capsicum.
And that was the one that was proposed by a couple of people.
But again, Marianne said it so beautifully. There are no remedies for conditions. There are only remedies for symptomatic profiles or pictures. Homeopaths are profilers. Without a remedy image, without a pattern or a profile of symptoms, we're sunk. Which is why if you arrive at the scene of an incident, if you have no ability to assess or gather a profile, either historically or by means of obvious physical symptomatology, you're a lame duck. You don't know what to do, you call 911. And if there's any doubt, you call 911. If you
Absolutely.
can't, I'm sorry, Marianne, you go ahead.
No, I said absolutely. I'm agreeing with you entirely. And the reason that people have a hard time with homeopathy, or they say homeopathy doesn't work, is because they go to Sprouts and they get a remedy for cough and it doesn't fix anything, and then homeopathy doesn't work. Well, they haven't done homeopathy.
Exactly.
They got a this for that prescription, which is baloney. Just saying.
All right. So we've covered our questions now.
Okay. Oh, head injury, one of my personal favorites. So you need to watch for signs of concussion. And vomiting is one of those things. First of all, loss of consciousness. If the person has lost consciousness, no matter who they are, they get sent away. But if they don't lose consciousness in an adult, if an adult vomits at all, they go and get checked out. Children can get 1 or 2 vomitings, and you don't need to worry about that. But after that, they need medical attention. So after I've said that, that's sort of around the problem that happened. So what you're looking for is change in mentation, that is to say their level of consciousness. You're looking for uneven pupils. That needs medical attention. And the problem is with head injuries that it might not be a problem the first day, but 24 to 48 hours after the head injury, there can be an intracranial bleed that causes them problems. So this is the big thing about head injuries. It's not just today. It's like 48 to 72 hours actually on down the line. And I'm going to show you, this is unequal pupils. You notice that her left pupil is very much larger than her right. That can happen very suddenly. And that's the kind of thing you're looking for after a head injury. Questions?
What are some of the other physical signs?
Well, it's a change in mentation. Certainly if a person doesn't have the ability to speak the way they did, their speech changes, it slurs, any of that kind of stuff. Their balance changes. Because head injury, the kind of symptoms you see in head injury depend on where the head injury was. So if you get hit in the back of the head, that's the occipital lobe. So you may have, the classic thing where people see stars. People actually see stars. And so you can have change in visual acuity. The change in pupillary size has to do with problems with the optic chiasm, which is if you take a stick and you go between your eyes front to back, and then you take a stick and you put it top to bottom, where those two meet, that's where the optic chiasm is, and if that gets inflamed, you have change in pupillary size. So it's all those things. Anything that you would not consider normal for a person after a head injury is a sign that there may be something else going on.
And how long would you put up with a headache before you would seek medical attention?
24 hours.
And is different types of headaches, for example, if someone gets hit in the back of the head and they have a headache in the front of the head, is that more serious than having pain where they got hit?
Probably. It's unusual to have that, but definitely any pain in the head that is not associated with the actual bump is an indication that something needs to be followed up.
All right. And then several people asking if one gets a concussion, how long do you keep them on arnica? And if you're keeping them on arnica, does that help to protect against an intracranial bleed, 2 days later?
Well, I would probably, as long as they were having some kind of symptoms, whether it was head pain or whatever, I would probably have them on arnica for at least 48 hours. It may well help them with an intracranial bleed, but that doesn't mean I wouldn't be looking for symptomatology. Head injuries are funny. We have a lot of kids now that are playing these ridiculous sports where they're heading balls in soccer and they're playing football, and they really, really, really do get serious, serious head injuries. And while these are acute when they happen, they end up being constitutional in the long run. And so that's a big issue. And I would not be giving arnica for 4 or 5 or 6 days in a row after a head injury. If things are not getting better, I'm saying CAT scan.
And there's an interesting question that comes up because you and Joe and Kim and I talked about this a lot when considering the remedies to include in head injury and homeopathic HouseCall, and that is natrum sulfuricum.
Mm-hmm.
As an acute remedy?
No, not at all. I don't think so. For head injuries, nat sulf, opium, hellebores, all of these things are after the fact. They shouldn't even be included in acute head injury.
And how long, what do you mean by after the fact? How long?
Well, it depends on when the symptoms turn up. I hate to say that, but these symptoms turn up, 2 weeks, 4 weeks, 4 months, 6 months after the head injury. Sometimes you just don't know.
That's kind of the classic natrum sulfuricum presentation, right?
Yeah.
Something that takes a while to come on.
Yeah. Well, one of the cases that I can think of that I had after a head injury was a young man that he worked on transformers, and he stood up and he hit the top of his head on something that was in the transformer area. I mean, and he really hurt himself. He knocked himself out, went to the hospital, all the stuff. Came out of the hospital, could not think, could not work, could not think. Had pain. It was not pretty. And this is 2 days after the head injury. And the remedy was hellebores. And it was a little miracle. And that was not 4 months down the line. That was a couple days. And I just happened to get to see him because his wife came out to the clinic where we had our outpatient stuff. So, you know, he could have gone on for a very long time with that. It still would have been a hellebores case.
All right. I think we have some more conditions to get to.
Okay.
Do we? I'm just guessing.
Yes, headache. So the big thing about headaches is why is it happening? We all have stress headaches. We all have tension headaches. But if a headache has gone on too long, it's an aphorism 3 thing. You've got to figure out why it's happening, and you've got to treat it. And the headache, for the most part, is going to be a constitutional problem. So using this program to deal with headache, you've got to realize that we're talking about today's headache, not a headache that's been going on forever. And you know, you need to look at any physical changes that are happening with the headache. So headaches that go on and on and on, or recur and recur and recur, are not an acute problem. Unless somebody is like hitting you on the head, you know, once a week or whatever it is. Headache is a constitutional problem. Questions?
None on this one.
Influenza, definitely an acute problem. Influenza is a respiratory problem, and the deal with influenza is you've got to worry about sequelae. Usually respiratory sequelae, usually bacterial respiratory sequelae. It's really important to take a very good case. It's also important to know, whoa, excuse me, my cat Abigail just, sorry cat, you just really blew it. She tried to jump on something and she fell. We're not looking at it because, you know, you don't do that to cats. Anyway, there's no such thing as stomach flu. Influenza is respiratory, and it is beautifully treated by homeopathy. But you've got to be very careful to make sure that you treat it appropriately, because some influenzas can kill people. And so it's a respiratory thing, and that's what you're treating.
All right.
Questions?
Well, we have someone asking about probable remedies, but I know that for influenza we had quite a few.
Yeah, well, influenza is lovely, and usually there's a genus epidemicus for influenza. Not 100% of the time, but probably 90% of the time. So it just depends on what comes around. Other questions?
Let's see. Well, more questions about flu remedies. I know that some of the remedies that we included in influenza were, of course, gelsemium and Eupatorium perfoliatum. I believe we have Baptisia in ours, arsenicum, of course, Bryonia, Quina, Nux vomica, Rustox. Those are the ones we have in there. And why not aconite?
Remedies.
There are. And why not aconite? I know we discussed that.
Well, I mean, if it's an aconite case, it's aconite.
But I think we had talked about how infrequently flu comes on that quickly.
It's very, very uncommon.
For it to
But if it does, aconite can be the remedy. It's the question is, what are the symptoms? That's always the question.
Indeed.
Anything else?
Nothing else on influenza.
Kidney stones. So, kidney stones are generally beautifully treated homeopathically, or the pain of kidney stones, because kidney stones are not treated. It's the pain of kidney stones, and it's the pain of passing the kidney stones that we're worried about. And the deciding factor is how big these puppies are. Because if you cannot get the ureters or the urethra to dilate adequately, given the size of the kidney stone, it's not going to pass. And I'm thinking that what homeopathy does is help relax the muscles in the ureters and in the urethra in order to allow the kidney stone to pass. If it can't do that, then homeopathy is not going to dissolve the kidney stones. So what you need to do to get this person help is, if they have unbearable pain, and of course pain is relative, I understand that, or there's a lot of blood in the urine, then they need medical attention. That's just all there is to that. Questions?
None on kidney stones yet.
Okay.
Since we're going on about 10 after, I thought I would maybe help. How many more conditions do we have?
Gosh, I'm on K.
Yes, that's what I was thinking.
I only have 18 slides, so I don't know how many I've used so far. So I could be getting close to the end.
That would be okay, because we do want to leave some time for questions at the end. But
yes.
Anyway, we don't have any questions about kidney stones right now. So.
Okay, then I'm moving on. Oops.
Moving backwards.
Miscarriage. Are we good?
We are good.
Okay. Miscarriage is one of those slippery slopes. You really have to know where the woman is in her pregnancy. If it's in the first trimester, the miscarriage is undoubtedly more about a problem with the baby than it is a problem with the woman. After that, particularly if the woman has more than one miscarriage, it probably has to do more with her hormonal situation than it has to do with the baby. If it's her hormonal situation, it's a constitutional thing. There's no question about that. So what you need to do is check for nausea and vomiting, check for the amount of bleeding, and check for the level of pain. The real pivotal thing is the second trimester, where homeopathy may be actually able, for whatever reason this lady is having the miscarriage, if she's never had a miscarriage before, if she's carried a child to term, in the second trimester, homeopathy is probably going to be the most effective at that point. If it's a third trimester, maybe not so much. Maybe you've got to think about medical attention. If she's had multiple miscarriages, you've got to think about medical attention. You also have to think about constitutional stuff. If it's first trimester, you just have to keep her from bleeding out. That's pretty much it. Because in the first trimester, if a person is miscarrying, if they haven't miscarried before, there's probably a problem with the fetus. So, it's a judgment call, whichever way you go. Questions?
We did have one, but I'm not sure it was typed in correctly. Can homeopathy help in the first trimester?
Well, it might be able to. The question is, do you want to intervene?
I think maybe the question is, there's a couple different questions, right? One is the idea of whether the remedy can help with the symptoms of the miscarriage, that is to say, the bleeding and the discomfort, and the emotional trauma if it's a first pregnancy.
Yes, definitely.
As opposed to, saving a fetus in the first trimester. I think that's what you're suggesting, is that in the first trimester, you're probably not going to stop the miscarriage itself because there's something wrong with the fetus.
Right.
But you may still be able to help the mother.
Oh my God, yes.
Yeah.
Because there are certainly two things going on here, as your questioner pointed out. There's the stuff with the mom, and there's the stuff with the baby. Stuff with the baby, probably not so much. But the stuff with the mom, certainly. And you always want to prevent bleeding. You want to prevent hemorrhage. You want to prevent pain. You want to make the mom comfortable. And so, yeah, homeopathy can definitely do that. But I just don't want any expectations that you're going to fix a fetus, because the chances of that are really not good.
All right. So I've got a couple of questions, but why don't we move through our conditions, and then we'll have some questions waiting for us at the end.
Okay. Oh, we're down to V.
That was quick.
And vomiting is essentially the same problems as diarrhea. Dehydration is our main problem. But what we'd like to know is the vomiting caused by an infection, by poisoning, like from a mushroom or something that was eaten, or by pregnancy. And so dehydration and fluid loss are the essential things that we're concerned with, because that's gonna cause a person giant problem. Questions about this?
Do you have any quick hints as to how we're going to assess the cause of the vomiting?
Well, probably questioning the person is the biggie. Has anybody else in the family had any vomiting? Has there been an infection around? We already talked about there is no stomach flu, but there is virus and other pathogen cause for vomiting. Have they eaten anything anywhere that could cause them a problem? And of course, vomiting of pregnancy, which is pretty common.
And are the most common vomiting from poisoning, is that most commonly from food poisoning and or alcohol?
Yes.
Okay. So that may be fairly easy to figure out.
Pretty much.
How about black vomit?
You mean blood?
Indeed.
Well, I would be getting right to medical attention at that point, because we do not like that coffee ground emesis, as we say in the nursing biz. And that usually means that there is a leak somewhere in the upper GI tract, either in the stomach or the duodenum. And that's an ulcer. And that's another smoke entirely.
All right. So do you have another condition?
I don't know. Let's look. Oh, how come sore throat is after D? Anyway, so what we need with sore throat is to determine what the reason for the sore throat is. And of course, the most famous one is streptococcal infection, or strep throat. And you can see enlarged tonsils. Sometimes there are white patches, although not entirely. And what we worry about with this kind of bacterial infection is peritonsillar abscess, which is an abscess behind the tonsils that you can't see, which is a giant problem. Now, here, can everybody see these lovely tonsils?
Those are some doozies.
With their little crypts. So if you just have you can see this. You don't need special equipment. You can have the person open their mouth. You will see large tonsils on either side of the uvula, which is that thing that hangs down in the middle, and it will have white patches on it. It's not absolutely indicative, but it is a good indication that you've got an infection in the tonsils, particularly if they're quite large and the person is complaining of pain. The other irritating thing is that some kids, it's kids, not adults, can have strep throat and not have pain. That is very irritating to a practitioner because it leads them in all other directions that they don't need to go. But what has to happen is they need a quick strep, so that you at least know what you're looking at. Because it's an aphorism 3 thing, which of course is my personal favorite. It'll allow you to understand how you need to treat and what you need to look for. Questions?
If the glands along the side of the neck are swollen with a sore throat, is this reason to be seen by an MD?
It could be. And actually, any kind of sore throat can cause anterior cervical nodes to be swollen. Usually, particularly if it's not a strep infection, and you give the proper homeopathic, those glands will be gone by the next day. At least that's my experience.
Yeah. Well, we have a couple of good questions about other conditions. If we're done, I don't want to cut the presentation short.
Let's see where we up. Oh, tooth abscess. This is important.
Yeah.
Abscess teeth can be life-threatening. In the emergency room, I saw 2 kids under 30 die because of their tooth abscess that they didn't have the money to fix. So, if a person has a tooth abscess, you have to treat it. And you can treat it homeopathically, but they also need to get some dental assistance. And what the homeopathics will do is at least erupt the abscess on the outside, not on the inside, which is what you want. So you look for a spike temperature or a change in mentation when they have the abscess, and that lets you know you're in trouble. And you are in trouble, and they are in trouble. And this is a biggie. And this should not happen in this country, but it does all the time. Questions?
Is it okay to treat strep homeopathically, strep throat?
Oh, God, yes. Yeah, it's the best. Alantha is sort of the poster child for strep throat.
I'll type that one into the box here and send it out to everybody. It's a good one to compare with Phytolacca.
Yeah, very much so.
All right. And do we have another condition?
No, look at that.
The slideshow. So we had several
nothing.
questions.
Okay.
You got lots, but
I got nothing.
but we're through it all. So we had quite a few questions about the nausea of pregnancy and our favorite remedies for that.
Yes. Are we saying what are my favorite remedies?
Yeah.
Well, I've had a couple cases of hyperemesis, emesis gravidarum, and what is it? Symphylocarpus? What is that? I can't.
Yeah. Symphoracarpus racemosus.
Symphoracarpus racemosus. It's a friggin' miracle.
It's unbelievable.
Yeah.
I'll put that one in here as well. Symphoracarpus racemosus. Snowberry is what that's made of.
Yes. Yeah.
All right.
But it's not the only remedy. You got to take the case.
Yeah, we recommend. I mean, sepia is always something to take a look at. Nux vomica.
Yes,
I've had tremendous ipecac, of course. I've had tremendous results with Nux, and tobacum is the other one that we.
Tobacum.
Yeah.
Particularly if they're sitting outside with their shirt over their head and their eyes closed.
And looking green.
And looking green. There were some nuns on a boat going between Dublin and across the Irish Sea. I can't remember what they were, green. They could have used it.
All right. Okay, so we're kind of coming up on the end, so I'm running through the... so for anybody who didn't get the names of those remedies, they are both in your chat box at the bottom of the GoToWebinar control panel. That is to say, Ailanthus glandulosa for sore throats and Symphoracarpus racemosus for the nausea of pregnancy.
Not 4.
I'm sorry?
Not 4. They can be considered.
Suggested for.
Okay.
Suggested to study.
Yes.
And someone else is asking, are these webinars available online later? We did have some people write in that they had to leave early, they have to get up early tomorrow, or somebody said that it was 2 o'clock their time and they had to go to bed. And yes, these, all of the talks in this particular series, as well as all of the free casts that Whole Health Now does, are available on the whncourses.com website for free anytime you'd like to view them. And we had several people ask about some suggestions for tooth abscess, some remedy considerations.
Well, most tooth abscesses present as Hepar sulfuricum, but not all of them. Some silica, some even sulfur, but Hepar sulf is usually the way they present.
All right. And another question from someone about Homeopathic HouseCall, whether there are materia medica available, that is to say, materia medica comparisons available on the remedies. And yes, there are. If you work your way through a house call on the website, you get a list of recommended remedies. And they are listed in the order that they come up on the site, but they're not. But one of the things that we always say there to the side is, please read all of these and consider which one is the best match. You want to pick the one that actually fits the case and not just pick the one at the top of the list. And there are descriptions of, there are descriptions of each of those remedies in both their general presentation and their local presentation for each one of these conditions. So in sore throat, if we're looking at Ailanthus glandulosa, then we're looking at exactly what it looks like to see a sore throat with Ailanthus. And then there's also a description of what you might see generally with Ailanthus. All right, let's see. Someone was wondering if you could speak briefly about stomach ulcers.
Oh, okay. Well, stomach ulcers, of course, homeopathically speaking, are a constitutional problem. You may be able to treat the pain, but obviously the situation is a whole lot more serious than that. And so you have to figure out where the ulcer is, why it is, and there are probably not only homeopathic considerations, but also impediments to cure that need to be consulted.
All right, and let's do one last one from way back. Let's see. Someone was asking about, so you made the comment that, and there are actually two questions like this. We'll do two more. You made the comment that treating someone for kidney stones, you're not actually treating them for the stones, you're treating them for the pain of passing the stone.
Yeah.
And so someone is wondering, you know, if you're treating someone long term, constitutionally, quote unquote, is there a chance of dissolving kidney stones then?
Probably not. What you're doing is preventing the formation of stones, so you're regulating pH, you're regulating diet, you're regulating fluid intake, all the kinds of things that contribute to kidney stones. And you've also got to look at genetics. And there are some people that have a family history of creating stones, and so then you've got to ask, why is this family history creating stones? Do we have an abnormal pH in the urine that just is something they have? Is it some kind of lifestyle change that needs to be made? It's very multifactorial.
All right, just getting more requests for the names of these nausea of pregnancy remedies, so I'm sending that out again to your chat box. And then the interesting other question that came up was about UTIs, and we only have about a minute left. Do you want to speak briefly about what might send someone to the hospital with a UTI?
Yeah, flank pain. You know, pain in their back. So the UTI has gone to the kidneys. That's what's going to send them to the hospital for that. Or lots of blood in the urine. Either of those things.
All right. I think that covers us. I wanted to thank Dr. Ivans for a wonderful presentation tonight, and acknowledge Dr. Joe Kellerstein, who dropped in on us for a little while, and then went to bed, I believe. And Kim Leo was with us at the beginning as well. And so warm regards from everyone at Homeopathic HouseCall and HomeoAid and Whole Health Now. And I hope everyone has a nice week. And I believe we'll be doing this again. I think the next one is next Tuesday. I'm not positive about that.
Well, and I want to thank everyone, too.
Of course. So check the WH Now, that is to say, WHN courses. I'm going to type that in here real quick if my computer goes along with me, which it's not. That's why not. Okay, so WHN courses, still moving very slowly, .com, and you can find this talk posted there later this week. Take care, everyone.
Night, Heart.